Hello, bienvenue, willkommen, karibu, welcome to the Med Lounge with Christina, where we discuss everything medicine, health, and life. Hello, and welcome back to the Med Lounge with Christina. This is the Med Lounge. I am Christina, a medical practitioner based in Uganda. So we are continuing with our series on malaria, and today I have a very interesting topic. This is a topic that many of my patients always asked me about, and I would love to address it. When I was in school, when I was in secondary school, it was very common to find that students that had reported at the start of the school term would normally have to either return home or go to the sick bay because they have fallen sick just in that first 1 to 2 weeks of reporting at school. I noticed this mostly when I was at Trinity College in Abingo, and also later when I joined the medical field at my private practice. At OPD, I used to get so many parents complaining about their sons and daughters having to return home just a few days or weeks upon reporting at school because they've been found to be sick, and the main cause of this sickness would usually be malaria. So that is the question for today. Why is it that students from affluent families tend to fall sick or tend to get malaria just a few days after joining boarding school, or just a few days after returning to school in boarding from the holidays? So I bet it sounds surprising, like you would expect students from wealthier families to fall less sick, especially for something like malaria. But you find that when they join boarding school, they are more at risk of falling sick or getting malaria upon arrival at school. And today we are discussing why that is the case. So what's happening here? Let's break it down. So one of the causes is lack of regular exposure and immunity. Now, students or kids from affluent families are going to live in homes where we are having mosquito screens or insect screens, where they could be using mosquito repellents, they are sleeping in treated mosquito nets. So you find that they are less exposed to malaria bites. Now, if they are less exposed to malaria bites, they are also going to have a less immunity or a weaker immunity against malaria. And when they come now to schools where there is a higher risk of malaria bites, their bodies are going to be weak to fight off the infection in comparison to the students or the kids that are coming from families that are not as affluent. Reason number 2 is that at school we are having increased exposure to mosquitoes. Some schools have open water drainages. Schools may have bushes surrounding. Schools may have stagnant water. When kids wash and pour water anywhere, we are having stagnant water, and these are good breeding places for the mosquitoes. Then also we are in a shared dormitory, or we are in shared dormitories. You cannot compare the protection at home with protection that is in shared dormitories. At home, we are having air conditioning, we are having these mosquito screens, so which is not available in the dormitories. I may sleep at a window, and I prefer to have the window open while I sleep because it's a bit, say, too hot in the night. Then you find we are closing the dormitories late, the windows have been closed late, mosquitoes have come in. Then also you find that at home, kids are more likely to be guided by their parents, like to be followed up by their parents to ensure that you've slept in a mosquito net. No one is going to follow you up at school. The wardens and the matrons do not have time to make sure each child is sleeping in a mosquito net. And sometimes because of the sleeping arrangements, you find someone like the daycares, it's hard for someone to have their net up. So we may not be using the mosquito nets at school. So this leaves the kids exposed to mosquitoes at school, and the more we are exposed to mosquitoes, the more chances we are to get bites. The more bites that we get, the higher chances we are to be bitten by infected female Anopheles mosquitoes, so we end up with malaria. Point number 3 is a weakened immune system. If a child is transitioning from, say, being a day scholar to joining boarding, they are likely to be more stressed. There is a change in diet. There is increased workload. The kids may get sometimes poor sleep. So all these things lead to a weakened immunity. And with a weakened immunity, we are more exposed to diseases, and that includes malaria. So now that we have seen what causes this, the question is what needs to be done? What are the solutions? And in finding solutions, all 3 parties play a very vital role: the parents, the students, and the schools. We're going to look at what each individual needs to do. Starting with the parents. As a parent, you play a very vital role in preventing your child from getting malaria before they join school or before they go to boarding school. Before the child leaves, ensure that they are sleeping in a insecticide-treated mosquito net. That means during the holidays, while they are with you at home, they should be using the mosquito nets. Then you can consult your family doctor about malaria prophylaxis. The doctor will always guide you on whether it is needed before the child goes to school or not. We normally give it to children that are traveling from high endemic areas. Those are areas that frequently have malaria. Then watch for any signs and symptoms of malaria before the child leaves home. And in case there are any, in case the child has a fever, they feel fatigued, they are complaining of headaches, then ensure that you have done a medical checkup. You do a medical checkup before, so that if they are found sick, a medication can be given or started before they go to school. Now, I always commend schools that ask for a medical checkup for all students, and I commend the parents that genuinely do these medical checkups. I've seen parents that simply fill the forms or request the medical practitioner to simply fill the form without these tests being done. That is very wrong. I condemn that. I don't condone that. I do condemn it strongly. It is very important for you to do these tests because they're helping your child. You get to know your child's health. You avoid any surprises while at school. Then as a parent, what do you need to ensure that you pack for the child or that the child has packed? First of all, an insecticide treated mosquito net, that is a given. long-sleeved pajamas or evening wear, mosquito repellent. Now with mosquito repellent, we need to be very careful. We have so many mosquito repellents that are not effective because of the resistance of the mosquitoes to some of the ingredients in these repellents. Make sure your repellent has what we call DEET and picaridin. So the mosquito repellent should contain those. Then if your child has been diagnosed with malaria and they've received a prescription, then they should carry their anti-malarials with them. I always advise that we give these medications to a school nurse and not have the kids keep the medication with them, just for safety reasons and to ensure that the child always gets to complete their dose. Then as a parent, please educate your child. You need to sit your child down and educate them. What are we educating them about? Why they need to sleep under untreated mosquito net, why they need to use their nets, and how to properly use the nets. We need to encourage them to wear long-sleeved clothes in the evenings. We need to encourage them to use the repellents if we've managed to buy these for them, and we need to tell them to always go to the school nurse or report to their teachers in case they get any fevers or feel funny once they've reported to school. Then after school, when the child returns home for the holidays, what you need to do is simple. For the first 1 to 2 weeks, watch out for any signs and symptoms of malaria. Why the child could have carried the malaria from school or could have gotten infected at school. Remember that earlier we detect the disease, the best for the child, but the best for the family members as well, as this child that may have carried that disease could easily give it to the other family members. Then in case they are found, in case you see any symptoms, as usual, take them for checkup. Please always avoid self-medication. You could think it is malaria, it turns out to be something different. So it's always best to have the malaria confirmed, and that is by doing a test, by visiting the hospital and having the doctor recommend what is needed to treat, give the right dosages to the child. Then we go to the schools. What do schools need to do to prevent their students from getting malaria when they join school? Number one, we need to enhance mosquito control measures in schools by spraying. When I was in Nabingo, they used to spray, you would return and you find that funny smell of the dormitory. But spraying not only the dormitories but also the classrooms. Remember, students have night prep, so they are always in those classrooms up to around 9 or 9:30 depending. So we need to spray the classrooms as well with insecticides. Then ensure proper drainage to prevent stagnant water. Remember, stagnant water creates breeding grounds for the mosquitoes. Then covering water storage tanks. If you have tanks, ensure that they are covered so that we don't give these mosquitoes grounds where they will breed from. Then protecting students in dormitories. Ensure every child has a treated mosquito net. Now, most schools do ask for mosquito nets among the requirements. They check and ensure that every child does have a mosquito net. The problem is the schools do not provide provisions for the students to hang these nets. We need to make sure that the nets are not kept in the suitcases, but rather hang for the students to use. So we need to provide ways for the students to hang these nets so that they are used and not just brought and kept in the suitcases. Then educate students on the importance of these mosquito nets. They normally have excuses: when I use the net, I feel like this; when I use the net, it's not comfortable for me. When she gets up from the upper decker, she's stepping on my bed, she's stepping on the net. I can't breathe well with the net. They always have these excuses. But if we emphasize to them the importance of the nets, that will help much. And then encourage the students to wear long sleeved or long clothes in the evenings, and make sure that kids have pajamas. You can always check for these things when they report to school. Make sure they have night gowns. If they have a night dress, then it should have a gown or a robe. Then health screening and early detection. You can always screen students in the first week of reporting to school. We can carry out medical checkups. Then for those that ask the checkups to be done before the child reports to school, ensure that you follow up on these things. Sometimes you ask the parents to fill the forms, but the school doesn't even take an extra step to check who is sick, who came in sick, who is having what. So make sure you coordinate with the school nurses to use this information to your advantage. Then training the school nurses, wardens, and matrons to be able to detect symptoms of malaria early, so that the students can start treatment early before they spread the disease to others. Lastly, encouraging the students to report to the school clinic immediately they notice that they could be having symptoms of malaria or they feel not fine. I conclude by saying malaria is very preventable, and with the right steps we can prevent students that are just joining boarding or that have just returned to school from home from getting malaria and having them miss out on school days, or inconveniencing parents to have to come and pick students that have just reported to school because they are sick. So parents, schools, and students themselves, each one of us needs to play their role to prevent this. That is all I had for you today. I would like to thank you all for always watching these videos. If this is a topic that you found interesting, please feel free to share the video with those that may find it interesting as well. As always, continue to like, subscribe, share these videos, and until next time, as always, au revoir, kwaheri, cheers, goodbye.